social distancing, lockdowns, mass testing and herd immunity. In this video, we're going to look at each of those responses to coronavirus and see what's happened when they've been used. COVID-19 has brought countries to a standstill and they've all responded in different ways. We saw a lockdown in Wuhan in China. Now countless others have done the same. Italy, Spain, France. Cities like here in London have called on people to socially distance and work from home, which is why I'm talking to you from my bedroom. Now, why are governments taking these measures? The main thing is flattening the curve.
What we need to do is flatten that down.
Flatten the curve.
Flattening this curve.
Why do you want to flatten the curve?
That's the idea that in fighting this pandemic, we need to slow the rate of infections to give hospitals the chance to deal with patients without being overwhelmed, as well as giving us more time to find remedies and vaccines. Now, while everyone agrees on the need to flatten the curve, how we get there has been up to debate. So let's take a look. Now, one of the earliest methods to implement is social distancing. Now, a virus like COVID-19 can be spread when people with it have close, sustained contact with others who do not yet have it. So social distancing is about trying to stop the chances of that happening. So that's not just hanging out with people with the virus, it's cutting down on all non-essential social interactions, as well as not using public transport when possible and working from home, like me right now. It's also about avoiding large and small gatherings. Germany recently said there should be no gatherings of more than 2 people. That's why in places like here in London, clubs, restaurants, pubs, leisure centres have all been closed.
Social distancing is implemented once public health officials recognize that the disease is going to spread. It is here, it's going to spread, but there are actions that we can take in order to reduce the rate at which it spreads. Social distancing is a tried and true public health intervention.
Given that social distancing is an agreed upon method to helping stem the spread, that's why some experts criticise countries like the UK for not calling for social distancing earlier. The UK's chief science officer said that it wanted to time things correctly and there was a danger in moving too quickly.
So the timing is critical. And that's true across all of the interventions we've looked at. That's why this is a package of things that need to happen at the right time and in the right phasing.
However, the UK government switched its path a few days later, as new modelling showed that drastic suppression measures, like social distancing, would cut deaths to tens of thousands rather than hundreds of thousands. For that to happen, the modelling said all households needed to reduce contact outside the house, school or workplace by 75%. But there's still a lot of criticism that social distancing is not being adhered to. Look at Bondi Beach in Sydney after Australians were told to social distance. It was still packed. The beach did eventually close after scenes like these.
If the community does not comply, well then this is going to become the new norm.
So what happens when you make this type of thing mandatory rather than advisory? One step further than social distancing is locking down an entire city or even country. That's what we first saw in Wuhan on January the 23rd, where the coronavirus was first recorded. China put people in the region of Hubei, home to nearly 60 million people, under strict quarantine and travel was restricted. The WHO said it was a move unprecedented in public history. What did that mean? Well, in Wuhan, all public transport, including buses, railways, flights and ferry services, were suspended, and residents were not allowed to leave the city without permission. In Italy, we saw the same thing, with 60 million people told to stay at home where possible. Residents can only go outside due to an urgent need, like buying necessities, and are expected to carry a form justifying their reason for travel. They face a fine if not. France also did the same on March the 16th, issuing a strict 15-day lockdown. And the UK, after a week of asking people to socially distance, enforced their measures with a 3-week lockdown.
If you don't follow the rules, the police will have the powers to enforce them, including through fines and dispersing gatherings.
Now, given lots of countries are doing this, it seems this is an agreed upon way to tackle the spread of the virus. However, there are issues. Firstly, Italy saw rises in deaths and cases after the lockdown, so that raises the question of how effective it is. Some commentators point out that Italy can't enforce its lockdown in the same way as that an authoritarian regime like China can, with the number of cases from inside the country dramatically reduced over the weeks. Yet Bruce Aylward of the WHO said that China stemmed the virus's spread by rapidly testing people, placing those confirmed or suspected to have it in immediate isolation, and then quarantining those who had close contact with that person for 14 days.
The population knew what it was looking for. They knew what this disease was. They knew where to go to get tested, and they could be isolated and taken care of very, very quickly. People were part of the solution. They were the surveillance system. And what worries me always, Matt, is everyone starts with, we can't do what China did. And I said, well, why not? And they said, well, we can't lock down a whole city. And I said, well, China didn't either. I mean, they have thousands and thousands of cities. They locked down a few, where it had really gotten out of control.
And that's where we come on to ensuring everyone gets tested. The WHO has always held up South Korea as an example of how to tackle the spread of the coronavirus.
A month ago, the Republic of Korea was faced with accelerating community transmission, but it didn't surrender. It developed an innovative testing strategy. It did exhaustive contact tracing.
South Korea very quickly developed a test and immediately began testing thousands and thousands of people. They could do 20,000 in a day, even testing those who do not have symptoms, using drive-through centres as well as novel facilities like this, a sort of phone box drop-in outside a hospital in Seoul that allows anyone to take a test without coming into contact with a doctor.
간단합니다. 그 공중전화 박스 크기의 부스 안에서 환자가 들어가서 진료를 받는 그런 시스템을 말하는 건데요. 그러면 의사와 간호사는 부스 밖에 있게 되는 겁니다. 그러면 일단 직접 접촉을 안 하게 되는 거죠.
So South Korea made testing free and available to all and quarantined those who had the virus. One infectious disease expert told Science magazine that South Korea's example showed that, quote, contact tracing is also very influential in epidemic control, as is case isolation. Basically what Bruce Aylward from the WHO was saying earlier. But countries like South Korea and China also used apps to monitor the spread of the virus, the ability to know who has the virus and look at who they've come into contact with. So how do those apps work? Here's a little explanation. Here, subject A has the coronavirus, but doesn't yet know it or show any symptoms. In their day-to-day life, if they come into contact with other people at home, on public transport, or even at work, when their symptoms begin to show, they can request a test. And if it's positive, all the people they interacted with are immediately notified by the app and told to self-isolate and get tested themselves. The places they've visited are then decontaminated. Of course, this raises the issue of the invasion of privacy and us entering a sort of big brother world. But is that worth it when trying to fight this virus?
It's about using a 21st century technology to implement age-old principles of epidemiology to rapidly, instantaneously identify those people at risk themselves and those people at risk of passing on their virus to other people.
Now, things like social distancing and lockdowns are about suppression, which aims to reverse epidemic growth. Yet there was a lot of discussion about the concept of herd immunity after Sir Patrick Vallance said this.
It's not possible to stop everybody getting it, and it's also actually not desirable because you want some immunity in the population. We need to have immunity to protect ourselves from this in the future.
He talked about 60% of the population in the UK, some 40 million people, catching the virus to get towards this herd immunity. That herd immunity concept is the idea that if enough people become immune to the illness, in this case because there is no vaccine, they contract the virus and recover, the coronavirus can no longer spread. Basically, the more people you meet who are resistant to the infection, the less likely the illness has to infect someone who is susceptible. After a while, the virus will not be able to infect enough people to sustain itself in a population. However, that approach was criticised, including from one of China's main respiratory specialists.
往后我觉得不能够靠这个所谓的集体的免疫来解决问题，这是一个传染性很高、病死率很高的。
Certainly, we still don't know if people who catch the coronavirus will become immune for life afterwards, and it's not clear whether people can become infected again, or whether the disease will behave like flu in the future and mutate into new strains to which people are not immune. And it's worth remembering amidst all this that people here are changing their habits to help tackle this virus. A new survey by Imperial showed that more than half of the population are avoiding crowded areas and 83% are washing their hands more frequently. We've seen a range of responses from different countries as this outbreak has spread. China was first, and many have begun to follow their example, with social distancing and lockdowns. Yet the message from the WHO has always been that that by itself cannot work. It needs to be backed up by testing, to ensure that we can monitor how the virus is being spread and stop those who might not even know they have it to stop actually spreading it. While we're in an interconnected world, nations are still choosing their own pathway when it comes to tackling this virus. And that can cause you some confusion or mixed messages, as you see some countries take different measures at different times to your own. Let us know how you've been dealing with the response by your government in your country in the comments below. And make sure you wash your hands, keep your distance, and stay safe.